Dr. Kareem Kurji, York Region's Medical Officer of Health. Doctor, good afternoon and thank you for your time.
Thank you, Akshay. Most welcome.
So this is a very important issue we've been discussing about a vaccine passport. Some provinces have already started issuing one, Doctor. Ontario government officially has said they will not do it, but local public health units are saying they will create their own. Where do you stand on this, Doctor?
So we are in a state of dialogue, both with our fellow medical officers of health and our regional chairman is participating in meetings of the mayors within the GTA. And this has to be a process of dialogue. What we are actually seeing is that 8 out of 10 cases that we see are in the unvaccinated or partially vaccinated individuals. And we project that we will be getting into as many cases as we saw in the third wave. So we are looking for ways whereby we can dampen the curve. Now, the key thing, of course, is to get people vaccinated. However, we are doing everything we can to push that envelope. We believe that vaccine certificates will be one way of being able to get these individuals vaccinated. It is important to ensure that we keep both the unvaccinated as well as the vaccinated individuals safe. And one way of doing this might be to ask the unvaccinated folks not to come to gatherings, not to go shopping, to stay at home as much as possible. We have actually been asking the hosts of various events to only invite vaccinated individuals. However, I think the time has come for us now to move to the vaccine certificates. And for this, we would actually require the province's involvement, both from a verification process as well as mandating that. So we are hopeful that the province, with whom we have been working very effectively throughout the pandemic, will come over and will move in that direction when they hear all these concerns. And remember, this is a fluid situation, and it is a situation that constantly evolves. And we hope that the various partners, the province, us, business leaders, our mayors and chairmen, will all be coming to some sort of consensus.
Like you pointed out, this is about dialogue, Doctor. It's very important because the province, like we've heard in the past, is worried about the fact it may divide society between the vaccinated and the unvaccinated. But let me ask you this. We know that most of us who have received like a double dose, we received a receipt from a receipt on double vaccination from the Ontario Health Ministry. Could that work as a certificate or an option instead of having an application like Quebec does?
So many people think that those particular certificates are very easy to forge. And there are many MOHs that are not very comfortable with that. So it behoves us to look at credible options. And here, I think we would really need some verification process by the province. And also, there's the issue of mandates as well. We do know that many workplaces, thankfully, have implemented policies, and we encourage more and more workplaces to do so with appropriate legal counsel. But it would have to be the province that would have to play a more major role if vaccine certificates were to take a proper hold in Ontario. We don't want a patchwork of systems.
Right.
With everybody using a different app and a different method. It's going to cause so much confusion.
Right. All right. We leave it at that for the moment. You're saying consistency is the key. Dr. Kareem Kurji, York Region Medical Officer of Health. Appreciate you joining us, sir. Thank you.
You're most welcome, Akshay.